So you're seeing the first slide, you're hearing my voice, Dr. Keith, and you're seeing the lovely Lorraine and husband John, who are our star technical turn there. The good-looking one on the right is the one you want to concentrate on,
Yeah,
not the one on the left.
Me on the right.
Yeah. Okay. All right. Well, we're way past the 100 mark now, so it's a good job I booked some more seats, isn't it?
Yeah.
Okay. Well, I'll tell you what. We have quite a lot to get through, folks. Perhaps too much, really. We might have to talk a bit fast at parts, but I do know from, we've done something like this twice before with John and Lorraine. And honestly, the questions amount to nearly as much time as the presentation. People have, Viv's been getting questions all week, guys. Will it work for this? And will it, of course, she's the wrong target. Vivi doesn't know. But we stored them all up for you, so we'll try and get through as many people's questions as we can. Hopefully, we'll answer a lot of them before we get to question time, meaning, if you've got a question, don't bother sending it in yet. Wait to see if we actually deal with it. It's possible we might. And if not, then, of course, ask your question. That's what we're there for. Excuse me, that will be there at the end. Let me just take a drink of water, then I won't cough and splutter into the microphone. Right. Okay, so we're going to be talking about microcurrent therapy. We'll tell you what that is. We're going to explain how that will speed up wound healing. Why do we have pain, John?
Well, something is wrong when we have pain, unless we were born that way, which is, I doubt very much, but usually it's because the body is giving us a signal that something is not right.
Okay, and why don't we heal faster? Well, we've seen amazing fast healings, like frostbitten toes all back to good in a week. So that's amazingly fast. So why doesn't that happen normally? Why do we have to step in with these amazing instruments and do that? Why is nature a bit slower, do you think? Any idea?
Yeah, I think what we've seen in wound healing, for example, is that one of the reasons why wounds delay is because there's a lack of oxygen at the site, and the oxygen, of course, is carried by blood flow, and the blood flow will do its job. And if it doesn't heal quickly, then infection sets in, and so on and so forth, and it delays it even more. So I believe that getting blood flow at the site wound or the wound site is imperative to getting these things moving.
Right, yeah, and it is true, isn't it? We tend to shut off. If you get an injured limb, you tend to shut down communication with it, which is almost exactly the opposite of what we want for healing.
Exactly right, yeah.
And helping small animals, are we going to cover that tonight? I think we are.
We're going to look at some cases that have come to us, and we've helped ourselves with our own pets, and you'll be surprised at how quickly animals will actually respond to microcurrent because they don't have any prejudice. They don't ask any questions. They just suck it in and heal very quickly.
Come back.
Come back for more.
Yeah, great. Okay, so let's introduce ourselves. Almost everybody knows me because that's why they're here. They subscribe to my list, but there'll be many friends and friends of friends who probably don't know who the hell I am. My name is Keith Scott-Mumby. I was a British trained physician, although I've lived here in the United States for over 15 years now. I've written quite a lot of books, and I'm a kind of name, if you like, in holistic health and have been for 20 or 30 years. Hey, listen, that's how we met these guys. I wrote a book called Virtual Medicine back in the 90s. John and Laurie read it, hot off the press. You got to see. Oh, it's still there, right? Okay. And so he said, I've got to meet this guy, and phoned, and eventually we started dialoguing, and now we're pals. They're coming to stay with us in a couple of weeks' time, and we spent some time in beautiful Vancouver Island, where they live. It's all gorgeous. So if you want to know more about me, go and look at alternativedoctor.com. But that book you just saw, Virtual Medicine, actually morphed into a bigger, thicker, I should have mine to show, shouldn't I? It's not here. Anyway, a much bigger, thicker version called Medicine Beyond, and there's full of good stuff. The important thing is that I back it all up with science. You know, it's not woo-woo. There are scientific papers that, in fact, you'll see that microcurrent therapy, far from woo-woo, has actually gone mainstream. We're going to be sharing that with you, and they're all jumping on it like crazy. Okay, so ladies first. Laurie, introduce your lovely self.
Hi, my name is Laurie Van Bergen-Haché, and I mean, really, I don't know quite what to say other than the fact that microcurrent is something that I'm very passionate about.
Oh, hang on, that's not your CV, is it? No, hang on, there we go. CV, no. Oh, let's do it in reverse. Let's do your CV. Come on.
Okay. So, I mean, I've taken many different certificates and courses to get where I am today. I'm a doctor of psychology and of natural medicine. But really, the field that I'm in now, just helping people heal with microcurrent, is the passion that I want to follow through.
Yeah. Let me move the image. It's covering your face. Lovely picture. Yes, I mean, you've got all kinds of good stuff here. MA from London Open, and board homeopathy, kinesiology, TCM. And of course, you and John founded Pacific Health Options. If you want to know more stuff, folks, I don't think there's a slide that covers it now, come to think of it. PacificHealthOptions.com. And we're using all sorts of fancy terms now, aren't we? Instead of scanners and things, we're now applied bioelectrophysiology or microcurrent therapy and so on. All good stuff. You know, it really has arrived now. Come on, John, introduce yourself.
Well, I've been around for longer than I want to talk about, 35 years ago. And it all started in herbology, anatomy, physiology, pathology, and then I went into naturopathy, and I got my doctorate in natural medicine, which included also certificates in homeopathy, traditional Chinese medicine, biofeedback, neurofeedback, and so on and so forth, microscopy, so on and so forth. I think the more you know you don't know, you know.
Yes, so true, so true. But I mean, you are a recognized world-class expert. I mean, you get shipped around places like Malaysia. They drag you over there to go and teach them and things, don't they? So you get around. You're an internationally recognized figure, no question. Mm-hmm. Yeah. All right, you don't want to be modest then. Okay. Leave it to me, I'll boast for you. Okay, so we're going to talk about pain, inflammation, a certain amount of skeletal deformity and so on. Painkillers, I mean, pain's bad enough, but painkillers are lethal. And there's a big public drive, of course, going on, isn't there, because of opioids and opioid addiction. And doctors have really very little else to suggest or to offer except painkillers, and then stronger painkillers, and then stronger still painkillers. They don't have any actual solutions. You know, they can't persuade the body to turn off the pain and heal or settle down because all pain's inflammation in one form or another, isn't it?
Mm-hmm. I'm not a big supporter of the pharmaceutical industry, really, because I feel that if they were really serious about what they're doing, then they would come up with medications that don't have adverse side effects and things that will put holes in your guts and things that will massacre your kidneys and your liver, and it might even kill you. So until they stop doing that.
I think you can trust me, everybody on this call doesn't like Big Pharma. I think we can take that as a given. Their scruples are non-existent. And of course, the thing is, they want people addicted to painkillers. They don't want them to have a permanent cure. They want them to have to take painkillers 3 or 4 times a day, every day for the rest of their life. That's excitement for them because it means money and money forever. So they don't want solutions. We want solutions so that, we start treating a person and by the end of a few days or a week, couple of weeks, the person doesn't have the painful condition anymore. Nothing else really is acceptable, basically. Yeah. Now I've got a little panel here showing, so I'll just run through this panel, but all these different kinds of chemical solutions, as it were, steroids to shut down the inflammation. You've got Tylenol and the simple things, and aspirin. The middle of the road ones, non-steroidal anti-inflammatories. But then, over on the right there, we've got opiates, the big bad opioids, tramadol and all those things that we really, really don't want people to take. Just run us through some of the side effects, John. Here we go.
Yeah,
Let's start with Tylenol. Even Tylenol is pretty scary stuff, you know. It ruins your kidneys for a start.
Yeah, it can, and I think one of the reasons why they moved to NSAIDs and they moved further up the COX inhibitors was because of the damaging to the general population that these medications were doing, like Tylenol, for example. And people think that because I'm getting it over the counter, it can't be bad. I mean, it won't do me any harm. And I can take several of these a day and control them and manage my pain. It never goes away. The next thing you know, you've got bleeding ulcers in your stomach. You've got all kinds of different problems going on in your body, and you don't really attach it to the Tylenol because it can't be bad stuff.
Yeah, well, it's sort of famously harmless, isn't it? You give it to kids if they get a fever. But over the decades, it's emerged how toxic it really is, but nobody's sending the message out. You know, it doesn't suit the industry, of course. NSAIDs, they're supposed to be, non-steroidal, so you're not using those horrible steroids, so instead you're using the horrible non-steroidal anti-inflammatories back in the same place. They're pretty bad news, aren't they, on the whole? Aleve and Advil, those kind of things. Steroids we know are bad. I mean, certainly short-term they do work miracles, but the problem then is getting the person off them, isn't it? I mean, it doesn't kind of really solve it. It quells it by sitting on the box lid. But if you get up again, the box will explode and empty out again. So you're not really getting anywhere. And this terrible problem of tailing them off, it's really bad news.
Yeah, prednisone is really bad because it attacks different parts of your body, and you're trying to control inflammation. They put you on them for 30 days, and then they take you off. Now you're worse, your inflammation has come back, and you're possibly worse than you were because the adverse effects have attacked everything from your collagen to your potassium, and you've got a brown face, and you
have this rebound effect, don't you? Like it rebounds worse than ever. And so the doctor's often in the position, oh my God, you better go back on them.
Yeah, nervousness and anxiety and all of these things. But the COX inhibitors, there's so many people that have died of heart attacks with Vioxx that Merck Pharmaceuticals will be in court for the rest of humanity.
Yeah, I mean, nobody knows, do they? The official figure is 60,000, but I think it's more like 600,000, actually. Nobody really knows how much. They sat on it so carefully, tried to do damage limitation, and the opiates and opioids. Well, all of this is bad. As you can see, it's a list of bad things, but the worst of all is that people get addicted. That's the big problem, isn't it?
That was what was not supposed to happen, according to Purdue and the other people that make these things, like OxyContin, oxycodone. And they went to see the doctors, and they oversold the idea of opiates, saying these are not bad, there are no adverse effects to them, and people don't really get habituated to them.
Yes, it's basically sales bullshit rather than science. And I believe the Purdue founders got hit. I don't know whether they've been in court yet or went to jail, but they certainly got indicted for that.
Not in jail. They actually got sued for $500 million. Said it was the cost of doing business. They were shut down. And now they're in Asia, starting all over again. Oh,
God. These people, they have no scruples. So, big question, John. What options do we have? Oh, lots. Otherwise, you guys wouldn't be here. Let's take a look. We can electronic pain relief we're going to be talking about. Now, it's very important to say this is not TENS. A lot of people might have heard of TENS, where you just fry the nerves up your spine and you don't feel anything anymore. That's great, but frying the nerves is not a good idea. The voltage is rather too punishing and damaging. We're talking here about microcurrent, and that's a word you'll hear over and over. And of course, we're not relying on chemicals at all. Although it's correct to say, isn't it, John, that we will change the chemical goings on in the body. The different biological pathways will alter under the guidance of microcurrents. Telling them what to do.
Yeah, it's interesting to note that microcurrent is 1,000 times weaker than these TENS devices.
Yeah. And that's only. I mean, I've got to be careful because my really very dear friend Norman Shealy invented the
Oh,
TENS
yeah.
issue, and I don't think old Norm would like me knocking it. But there are problems. You know, there are problems.
Yeah, but it's a great muscle rehab machine. If I wanted to rehab my muscles, I would use TENS. Yeah, definitely. Although I know more about microcurrent now, and I would possibly circumvent the use of TENS devices, but
Yeah.
TENS were meant to really muscle rehab.
Right, but you know, can I sum it up? Is this correct? That I mean, TENS is basically blocking the nerve pathways. I said it fries, and that's a bit extreme, but you know, it kind of knocks them out a bit. Whereas what we're doing with microcurrent therapy is altering the pathological condition. So we're settling down the inflammation, or we're realigning the tissues, or whatever. Would that be
I call
a
TENS
distinction?
Electronic Advil.
Yeah. All right. So we're talking. Well, let's start with pain. Okay. So there are two kinds of pain. Yeah.
The major ones are acute and chronic pain. Acute, we all know, like you scrape your knee, you bang your fingers under a garage door, whatever. And we know that that's what we call acute pain. But when that acute pain goes on and on and on and becomes a chronicle, then we call it chronic pain.
Yeah, and that means it's not being solved because it's not going away. You know, if you scuff your knee, check kiddie's knee, like this kiddie with a scuffed knee. If you looked at that knee a week later, you wouldn't be able to see anything was going on, and there'd be no pain. But chronic pain doesn't go away. Ergo, there's no real solution till we come along. Okay, now talk us through this. This is James Oshman, and he knows a bunch of stuff. Tell us about the living matrix. Would you want the next slide for that one, or James's Bonnie portrait? Shall we use this one?
Now, here's what we're seeing basically is Jim Oshman, and I think he was a student of St. George at Princeton University way back when, Woods Hole and all that group, where they felt that the system was a lot faster than 160 miles an hour, which would be the speed of the nervous system, or maybe 3 miles an hour, which would be the length of the blood flow. And we're made up of 50 trillion cells, so there had to be another overriding system because the body needs to be omni-knowing all the time, and 50 trillion cells need information like right now. So they looked at collagen. Water-bound collagen has the capability of carrying information through the body at light speed. And when you look at each single cell, you'll notice these little dendrites that stick out. They're actually collagen fibers that connect to the other cells. So the whole body is like a living matrix of collagen fiber.
Yeah, and each part knows what the other part's doing virtually instantly, yeah? Which is amazing, yeah. And in fact, it's the only logical explanation for how you used a funny word, omni-knowing, and I don't think that word even exists. Can we say coherent for our friends? Can we just use the word coherent?
Yeah, I got
all
more.
parts are in touch with all other parts. Right?
When he doesn't know the right word, he makes up one.
Just make them up as you go. Okay. So how does microcurrent step into this matrix of, you know, instantaneous interconnectivity, electronic messages and things?
Yeah.
So let's sum that up. I'll just say that the collagen fibers, the wet or water-carrying collagen fibers, are the real electrical pathways. Nerves are. That's just another story. So how do we step in with microcurrent therapy, John? What goes on here?
Well, what happens here is we have the brain, we have the neurons which carry information via these dendrites that carry information to the knob, and then chemical reactions carry information to all of the different cells of the body. So what microcurrent does actually is it is the same current as our brain uses, and as our heart, and as our cells. So when there is a blockage in communication is when disease apparently starts up, unless you were, like I say, born that way, which is usually not the case. So when there's a blockage in communication, now that blockage can be caused by many things. It could be chemicals, it could be inflammation. it could be geopathic stress, it could be
Environment.
and the environment, so on and so forth, a broken heart. All these things can be blockages in communication in the body. And when that happens, with microcurrent, we seem to be able to go back in, clear out the blockages, and continue the communication.
Get things flowing again. Yeah, that's a good way of putting it, I guess. Listen, I'm not actually taking questions at this part, guys, so don't keep typing them just now. But Rebecca, who I just spoke to with the same surname as Viv's mom, maiden name, says, is this anything like DRG technology? I can't answer because I don't know what the hell DRG technology is.
I've only been around
Americans and their abbreviations, you know, I don't get them.
DRG.
I don't know what it is. We'd have to look it up.
Okay, all right. As I say, they just live with abbreviations, and I don't get them, most of them. Okay, so the Nobel Prize in Physiology or Medicine, or is it and medicine? Anyway, tell us what these guys discovered, John, and how valuable that is for us.
Well, when we hear medical doctors speak, you know, they say when you talk about microcurrent, right away they think of TENS devices. Oh, we tried that before. Or I don't know about the body. The body is basically a bag of chemicals, and they carry on with foolishness that doesn't make sense. We know that the body is electric. These guys won a Nobel Prize for proving it way back in 1991 when they came up with a patch clamp where they were able to isolate a single cell and measure the current that would be flowing through the membrane of the cell.
Right.
And I think in the next one we show the voltage-gated calcium ion channels that rely on voltage or electricity.
Don't get verbal diarrhea. Wait till we get the slide, right? We don't know what ion-gated stuff is just yet. You're going to have to explain that. But let me just bring in a point which I made very strongly and repeatedly in my book, Medicine Beyond, which is that life is electrical in nature. Listen, even nutrition is electrical, isn't it? You're stripped of electrons, they run through a pathway and then rejoins the electrons at the end of the pathway and is excreted. But life itself is defined by that electrical potential you see across the membrane. It's really all that stuff you learned at school, like respiration, reproduction, locomotion, and all those things. Yeah, interesting. But the actual definition of life is electrical potential.
It is, because when our brain stops, the electrical activity in our brain stops, or the electrical activity in our heart stops, that's when we're defining death. We say he's dead because there's no more life.
Yeah, I mean, that proves it's not chemical, because the difference between a corpse and a living person is the electricity. It's the same heap of chemicals lying on the floor, but it ain't moving no more.
Yeah.
So it can't be chemical in nature, and yet they're obsessed with this idea that life is biochemical in nature. Anyway, so all right, go to and explain roughly what this is about.
My favorite bit.
Well, listen, I don't think anyone would mind if we just simplified it, but membrane here, like millivolts at the cell membrane, is what drives transfer of different substances in and out of the cell. That's what makes it all work, yeah?
That's exactly right. Yeah.
Anything to add to that?
No, not really.
No,
we can see so. That resting potential, 70 millivolts.
Yeah, let's get on to the good stuff. Now we'll move into postural problems. What's wrong with this pretty girl on the left?
Well, one of the problems that we're finding with a lot of people is misalignment of their bodies. Now, if you want things to go up and down in communication, then the body has to be aligned to do so.
Right, so her spine is bent. She's carrying too much weight on the right hand. Her neck's not in line with her spine. She's a jumbled mess, yeah?
She's asking for trouble, basically.
I'm glad you said it. That's the way to put it. And then this jokey graphic on the right sort of says it rather well. We were like shriveled up and leaned over apes, and then we evolved into men, and now we're back to bent over apes called computer operators. In theory, the computer's an advance, but in practice, when you look at that, it's certainly not healthy.
There's no advancement there, is there?
Yeah. All right, now listen, I found this one fascinating. This, I mean, it's scary. This is just leaning forward. The representation there, that thing in the guy's hand, is a smartphone or a tablet. So talk us through this, John.
Well, normally the force on your neck, when you're well aligned, when you're very careful about your posture, when you're sitting in your chair properly and your ear and your neck are all aligned, then your head will weigh 10 to 12 pounds.
Which is easy to carry.
Mm-hmm. Yeah, yeah.
When you start moving forward 15 degrees only, you've just doubled the weight and more than doubled the weight of your head. And it's going to have repercussions if you leave it that way too long and you slip into that form of posture where you're spending so many hours on the computer or texting, so on and so forth. Then the weight goes 15 degrees, 27 pounds. And it's not hard to slip into that 40-pound weight on your neck and shoulders, which will have repercussion on your whole spine and lower back.
Right. And I mean, these are old fogies postures, aren't they? We're being aged by this, by sitting huddled at our computer and looking at our kit. It's the aging posture and response, really. So we don't want that.
You even see people walking down the street, don't you, in this position, texting as they walk.
Yeah, I mean, some of them don't even look where they're going. I go for a walk most days. I went for a 4-mile walk this morning, and I had to sidestep a girl who just wasn't looking. She was like, I mean, it's highly tempting to kick one of their feet from under them and say, "Wake up!" It's so wicked. I'm a kinder person than that, but to be honest, it would do her more good than leaving her alone. Shock her into action.
Wake her up, wouldn't it? It would shock her into sort of realization.
But it doesn't. I think we are getting into a habitual state of texting is normal. Their lives are now in front of them. I know that I have a teenage daughter whose life is in the palm of her hand. Yeah.
Well, you can do so much now from a smartphone, can't you? Exactly. But look at this, as you know, a lot of people who subscribe to me, the average age is rather higher. We're concerned, we're boomers, we want to hang in there partying till our last day on earth. Yay! But look at that one on the right. That's such a common posture for an older person. Yeah. And at that stage, they've lost control of their head almost, haven't they? It's like it's almost leaning them forward.
They'll be partying. They won't see who's in the room. They're going to be looking at
yeah. You want to check out the talent, of course. But, this is a serious message. Yeah, and of course we're saying this. Why? Well, we're saying it because microcurrent therapy can tone up posture and muscles. That's why we're saying it, isn't it? We're not just pointing.
Yeah, we do a lot of neck and shoulder work because there is this major problem and it's getting worse and worse. So we have a lot of people that come in like this.
I don't think I've asked you this on any previous webinars, but do you two guys subscribe to the idea this is a sort of holistic healing, that family troubles sit on your shoulders and neck? That's where it lodges. I believe it. I've seen it so often. I'm very convinced about that. It's not exactly
if people can release some of that family tension, then there's a lot more looseness in the neck.
Yeah, unless your name is Atlas or something.
Yeah, okay, I know. So now you chiros, they've invented a term, texting neck or anterior head syndrome. Tell us about that.
Well, this is what we're lapsing into, and I think we're seeing it in our younger generation. I was last summer. I was at the dark and beautiful downtown Victoria, and all of these tourists were pouring into this dark area, to the restaurants on the sidewalks, and every person that I saw go by that was less than 30 years old were holding these cell phones in their hands, and their necks were they were looking down at they didn't even enjoy the view. All they could see was their cell phones.
Well, they see the view through their cell phone, don't they? Because they're taking pictures, but they're not even looking at what they're taking pictures of.
Yeah.
It's kind of scary, isn't it? And then you were saying outside a restaurant, we've all seen this now. 2 or 3 people will meet up for lunch. They'll all sit down, take out their cell phones and start talking to the phone instead of to each other. I mean, it's crazy. Like, shall we do? Let's meet for lunch and we'll do cell phones.
I fly a lot, and what I find is that the first thing that they do when they get into their seats is pull out their cell phones, and they're either playing games as they're told to go to flight mode, then they go on to games, but it's their cell phones all the time. They don't speak to the people next to them.
Yeah. Well, it's a big socio-technological problem. I don't know what the answer is, but anyway, so we're talking about alignment. Walk us through these odd pictures on the right. What are those?
These are pictures of scoliosis, which is a deviation in the spine. You see the one on on the far left will be...
Let me just clarify, John. These are not just sort of temporary bending over. These are permanent deformities of the spine.
These are permanent deformities. We
Until you treat them, that is, yeah.
Yeah, we can. It's called childhood idiopathic scoliosis in many cases. It starts when...
Well, you've used that horrible word, idiopathic. Folks on the call don't know what that is. Idiopathic means there's no known explanation. It's just
no known explanation.
That's all it means, yeah.
That's all it means.
Yeah.
But it is a great medical term, so we can confuse everybody with it.
Yeah, yeah. I mean, it gets out of everything. Well, it's idiopathic, so we don't have to treat it. That's what...
We worry about
anyway.
the first part.
So look, you know, so you got the bend in the chest, you got the bend in the lumbar spine, smaller the back. You can have bends both ways, and that's only sideways stuff, isn't it? What the technical term is scoliosis. Then you've got the bending forwards and backwards.
That's right.
Bad news. Yeah. Now, what's this funny like marionette puppet thing on the left? What's that showing?
Out of alignment.
Yeah, the one when your shoulders are. If you look at yourself in the mirror, you look at your partner, your friends, your family, and you see the shoulders a little bit out, then chances are your atlas, that top part where your head sits on, the first part of your cervical spine, that may be out as well. And chiropractors make a fortune putting that back into alignment.
But they have to do it so often. We only have to do it once, and it
yeah, that's a great point. Yeah, I mean, chiros make a lot of money out of tweaking your spine. I've heard them pull and crack and tweak until you're shaking like a piece of rope with nothing connected. I'm sure that.
I mean, a good thing that they're...
Listen, we have some very good friends who are chiros who are on the call, so let's be respectful.
Yeah.
But we like to have a bit of fun as well, don't we? So this is showing accelerated wounding. This is a skin graft on the left. That's pretty horrible. How long to the healing on the right, John?
The one on the right took 4 days.
Wow. I mean,
from the left, this was a bit complex because the person was his foot was stomped on by a horse. And my good friend Diane Evans is the one that submitted this to us. And what they did is they took a piece of skin off the guy's arm with the idea of transplanting it onto his foot. And then he got MRSA in his foot, golden staph, so on and so forth. It got really infected. And the one on the left was left to fester this way, and he was walking around with that kind of arm.
The one on the left is the arm, yeah. So we're not seeing the foot wound where the graft went. This is where the graft was taken from. Yeah?
Yeah.
Right, and then it healed amazingly fast. I mean, obviously that was struggling. Is that gauze in the wound? It is, isn't it? There's a layer of gauze in there over which the new cells are supposed to grow, but not happening by the look of it.
Interesting fact. You see this picture over here.
No. Try a bit nearer to the camera, but you might...
Yeah.
That's the book. We're going to be talking about this book a little bit.
Yeah, this is the Wound Care Dressings and Other Modalities, the handbook from Malaysia.
Well, show us the cover at least. We'll come back to that. We'll come back to that because there are folks on the call who want to know more about the techniques. Show us the cover.
Well, this one on the left, far upper left, the cover?
No. Listen, show me the cover of the book.
Oh, no,
we can't see the pictures inside. It's not sufficient.
No, I'm just going to get our book, though, Keith.
Oh, okay, Danny. Well, you do that while John and I will keep going then. So this looks pretty grim. That's a toes amputation, is it? The one at the top?
The right diabetic foot ulcer that had festered and gone into gangrene, and raised amputation simply means that they cut a chunk of that foot out. And it wasn't healing. It was done way back when, a 66-year-old Malay gentleman. And what happened with us is that I asked them if they would do a 100-person study because they had all of these people in this hospital and they were all suffering from diabetic wounds.
Right.
And so on and so forth.
Well, listen, we'll come to the details of that in a minute. Just talk us through the rest of this. So on the right, is that horrible wound at the top is healed on the right. How long did that take?
30 days.
Yeah, okay, that's still seriously miraculous. Now, this is those horrible ulcers that diabetics get around the lower leg, isn't it? And they don't heal real good because the blood supply is so awful down there. But one of the magic things that we can do with microcurrent therapy is open up blood flow and get healing, yeah?
Yes, and this one was around for more than 5 years, and we only had 30 days to get him well. And he was 100% better after only
So this
30
is
days.
part of that 30-day study, okay? So
That's right.
we'll look at the details of that study in a minute. What's this rather grotesque
What
thing?
is
I hope
this?
none of the viewers are feeling queasy. What's
Sacral sore or bed sore.
Oh, a bed sore, yeah. That looks pretty horrible.
Decubitus. A lot of people die from these wounds in old age homes.
I think more people die of that than fracture of the neck of femur, you know,
That's right.
which is a big danger to old folks, as you know. But once these get going, I mean, we can heal it. There's the evidence, but you know, they don't know what to do. You can't just keep pumping antibiotics into somebody. You'll just end up with a resistant infection instead. I tell you what, I might be tempted to, if I had to do it, I might be tempted to use Manuka honey in a gauze. But when you've got microcurrent therapy, why do that? Now, look at this horrible thing on the left. I'm sure it's going to turn somebody's stomach. But you could just stick a pair of tweezers right through somebody's toe. Why? Because it's pretty well.
Oh, well, we needed a picture.
I mean, that's a fairly graphic demonstration of the fact that that toe is done for, yeah?
That's right, yeah.
So that it isn't. You've saved it. That's the middle toe on the right. All right, it doesn't look real good, but it's healthy. It's all closed up, and it's alive.
Well, he was on medications, and he was walking normally, and the wound had closed 100%. So
yeah. So that's amazing, actually, if you think of that. So now tell us this. There's a fancy word here, angiogenesis. Tell us for the viewers.
Yeah,
explain what it means and why this slide's important.
Genesis is it's like the creation we see in the Bible and everywhere. But when we put a prefix like angio, it means like the creation of new blood vessels would be angiogenesis. And one of the big problems with that, what we saw a minute ago with that bed sore, and when they get deep enough, then the blood vessels, everything starts to disappear, and we no longer have blood flow carrying oxygen to repair those wounds. And in this case, what happened is the person had a cancerous tumor on, I think it was on their back, and when they took the tumor away, they left it with a gaping hole. So when they came to see, I think it was Diane again that sent me this one, after the first day of treatment, the picture above, far left, started to, it was not as enraged, it looked like it wanted to start healing. And on the second day, we could see how it was starting to close. And what we were doing here is we were putting, and this to those who are trained in medicine, if you're not careful, a wound may close from the top, leaving an area below not healed. So what she wanted to do was she wanted to put the pencil probe, within the wound itself. There's no nerves there; they're dead. I mean, there's nothing there. And immediately she saw the creation of new blood vessels, which brought in oxygen and brought in the nutrients necessary to create new blood cells or new skin cells. So within 4 days again, we saw it go from a gaping hole, not so enraged, starting to close, and close in 4 days.
Yeah. Amazing.
This is extraordinary.
Yeah, it is. For somebody familiar with traditional healing times. Okay, so I met Cody, didn't I, when I was up in Vancouver, and he'd just been kicked around by a horse, hadn't he?
Well, I think he met his mom.
Oh, was it? No, it's his mom. That's right. Yeah.
His mom,
I was going to say I don't remember seeing that head. No, I do because she put up slides. That's it. I knew.
She had pictures on the camera that he sent when he got into the car. He took a picture and he sent it home to mom and said, "Mommy, I think I'm in trouble."
Yeah, I mean,
horse threw me.
He could have had a smashed skull or anything. Anyway, so that's a left to right sequence, yeah, or is it? No, it's pairs, isn't it? First two pairs, then in the middle there's another pair.
Mm-hmm.
Oh no, I see what it is. The left one is the scalp crown. The third one along is a later version of that, and then the fifth one along is the final version of that. Yeah,
that's right.
And on his cheek, that's the second image. Is all.
Yeah, you can see teeth through these.
Like this. Now look, he's lucky. I mean, look at that mark on his face.
Yeah,
just a really cute scar. And how many days was that?
Oh my gosh, that was just several days. When his mom got home, I think it was on the second day, she started treating him immediately. And they live in Montana, so they're fair ways away from a medical hospital. And they do everything at home.
Yeah.
So he did
Resourceful,
very
yes.
well,
Okay.
probably within a week.
All right. Now, we're not trying to return your folks' stomach at home there. We're trying to make it clear that this is some pretty dramatic stuff we got here. This looks really bad, but look, it ended up like this, so don't feel sick. But tell us about this case here, this an elderly person.
Yeah, we hear so often about our elderly falling and hurting themselves, possibly because they're still on medication, high blood pressure medications, and they've gone into low blood pressure to feel dizzy, then they fall, and they hurt themselves very badly. In the bathroom is one of the places where they hurt themselves the most. And this is what happened. It was actually Sharon's mom, Cody's grandmother. Yeah. And after she fell, I mean,
Sorry.
Yeah, she went into the home and found her mom in this state, and immediately started with the microcurrent, and speedily got her back on her feet.
Right. Now, so this was the device we're going to call the Avatia, yeah?
That was with the microcurrent
therapy tool, yeah, okay. Next. Oh, well, there it is in the corner. That's a sort of professional kit. I mean, you know, to get these absolute miracle things, you might need the professional standard if you're a practitioner and want to take this kind of therapy on board.
These wounds are quite extraordinary. They're actually in the wounds
in John's book.
It's in my book now. We'll talk about my book.
No, you get a chance to explain your book. Okay, what are these dudes doing? What's nitric oxide? Tell us.
A couple of
years.
A
very educated list, but let's not make any assumptions. There might be somebody that doesn't know what the hell you're talking about.
In I think it was 1998, 1999, these three fellows discovered something that we call nitric oxide, which became really a big thing. As we know that upping your nitric oxide levels can help you heal from so many diseases, because what it does is it vasodilates, it opens the blood vessels up, and nitric oxide is produced within the intima, right within the inside of the tunic of the artery, and it releases this gas which signals the body to open the blood vessel and to increase the amount of oxygen, because you're increasing volume of blood. You'll be increasing the amount of red blood cells, and when you do this, you're increasing the amount of oxygen to the cell itself. And when the cell gets that kind of oxygen and food, it is able to make more what we call ATP, or energy. So the more energy you have, the more new cells you can create to help yourself heal. So nitric oxide, and we know that Viagra, for example, is an example of pure nitric oxide that will dilate blood vessels. Yes.
Well, we may not know that. So Viagra chemically works by releasing nitric oxide, increases blood flow, and that's exactly what you want for a good erection, yeah? So it does work. It's not a scam, is it? I mean, it's just not very safe, but certainly in principle, extra blood flow is a good thing. Right, what have we got here?
About 3 years ago, 2015, not 1915. 2015, I was asked to give a talk to the International Wound Healing Federation in Malaysia, in Kuala Lumpur, and they got so excited about what I was suggesting at the time that they decided to do that 100-person study. And then the study was so successful that they decided, the president of the association decided that he would present it himself the following year.
Yeah, okay, well, let's go and look at that, because that's coming up. Yeah, here you are. So you persuaded them to run this trial with 100 people suffering from all kinds of stuff, like, you know, what we've been seeing, wounds and open festering wounds and so on, that the person will be in trouble, possibly faced with amputations and things. Let's take a look at the results. So what have you got for us there?
Well, of course, the result, what they were looking for was wound size reduction. And here we see that 16 people were 100% healed. 13 were 90 to 99. And if we go down to the beginning over here, 20 to 29, only 3 people got 20 to 29% better, which is more than what most clinical studies ever hope for.
Yeah, so only 3 people didn't get 2/3 or more healing, yeah? Sorry, 1/3 or more healing.
Yeah.
So that's pretty sensational. And then this one is showing what? A series of symptoms, isn't it? So walk us through the bottom line then. Leg swelling. So that was 100%
That's right.
gone, yeah? Foot stiffness, 100% gone. Quality sleep, 94% of people benefited. Talk us through it, John. Skin
discoloration, 93.5. Leg heaviness, of course, was 99% got better.
Mm-hmm.
Early morning erection, they were measuring the amount of nitric oxide that they were producing, that was being produced through one of the programs that I'll describe in a minute.
Right. So we were just saying that nitric oxide is good for erectile dysfunction. And here they are, the guys waking up with a boner while they were being microcurrent therapy treated.
Yeah, they were healing a lot faster.
And that's good. All right. Frequency of bowel movement, is that helpful?
Well, yes, because I think when you look at it metabolically, when you're constipated, you're not going to heal as well if you're full of poop. So for them to get that frequency of bowel movement, where the medications, tramadol and other opiates, are actually known to constipate people. So when we were able to take them off these medications because of microcurrent, of course, the frequency of bowel movement increased.
Yeah, good. Okay, I can see that. So accelerated wound healing. We've been talking about this. I think we can move on from that. That's just to represent. Oh, here, this is a quote from that study, isn't it?
Yeah, that's right. Yes.
I'm going to have to move you. In fact, I'll tell you, I keep moving this around like I'm being sort of neurotic, but I'm trying to stay out of the way of the text. So we'll just have to go small. But this is pretty clear, although I don't know if anyone can read it fast enough. But a total of 100 patients with chronic wounds, such as diabetic foot ulcers, venous leg ulcers, and pressure sores, were recruited. They all had a reduction in wound size, with 16 out of 100, so 16% had complete wound closure. 89 of the 100 complained of pain. They all experienced reduced pain, yeah? And at the end of 4 weeks, 11 of them were totally pain-free. Well, ain't that just better than taking tramadol and all those things, yeah? Good. Right, so tell us a bit about your book, and you now have my permission to wave it freely in front of the camera for a moment. That's a pretty good graphic of it, though, isn't it?
Yes, it is, yeah. So what happened, it became the product of a thesis that I wrote last year at university, and it was written, of course, at the beginning. What I did is I had an interview with the president of the organization. And he said, I said, well, he said, could you write us a manual? And I said, if it's sanctioned by the Malaysian group, I said, I would love to write one. And he said, we shook hands on that. I said, okay. And in that critical analysis of how wounds are treated in hospital surgeries today, which is in the book as well, and why we're not healing. And I kind of point a finger at the present way that the VA and other organizations are treating wounds. And by the way, there were 1,500 medical practitioners at this international conference in Kuala Lumpur, and there was not one single North American in that group. They were all from New Zealand all the way through Europe and Asia, but not one single North American. And
it says so much about the state of medicine here. You know, medicine here in the US, I don't know about Canada, but in the USA it's crap. We're about 44th on the international list as judged by current, parameters used to monitor healthcare. We're behind Morocco and places like that. It's terrible. But that's partly the problem. It's just an attitude thing. are they really actually interested? No. Anyway, listen, people are still jumping on the call, some latecomers, but we'll try and keep it simple so that we don't blind anyone who didn't get all that early stuff. Let's move on. So we've got this PEMF that stands for pulsed electromagnetic frequencies. What does that mean, John?
Well, what we were looking at, because they were so worried that we would be removing the wonderful bandaging that they were putting on these people, and some of them were infused with silver, and they were very expensive bandages, so they didn't want us to take the bandages out to treat them. So we said one of the best ways to get through the bandages is with a wireless system, actually, that can go right through the bandages, right through clothing, if you will, and we get the same effect and a lot deeper. So what the Avasia people came up with was a device that would plug right into the Avasia and use the onboard frequencies to be able to drive these PEMFs, which are quite extraordinary. They help healing very quickly in a lot of the cases.
I'll just remind people what the Avasia is. We did mention it, but that's one of these microcurrent therapy devices. So what you're saying, John, let me be clear about this for the viewers, is that you can transmit the healing signal like with Bluetooth or Wi-Fi. You don't even have to touch the leg or the wound. You can sort of transmit the message. And of course, that's what my book, Virtual Medicine, is all about. Medicine Beyond it's all in the information and energy field. All right. So what can we do with pulsed electromagnetic fields?
Well, we can transmit wirelessly, which is kind of cool, through your socks, clothing, your bandages, your casts, and your other materials, except through metal.
Yeah. So, I mean, if a woman's got some, I don't know, kind of pelvic injury, she doesn't have to be undressed even for you to do some, you can give her first aid on the spot and some healing, yeah? I think you more or less covered the points on that one. Just go through the general benefits of it for me here.
So it will reduce pain very, very quickly. It's very effective. And inflammation, which is usually involved, inflammation, pain is a part of inflammation, like redness, heat, swelling, and pain. Inflammation was discovered 2,000 years ago. So now we're starting to understand that there is no more names of diseases. There's just inflammation that we have to deal with. And the effects of stress on the body and platelet adhesion, all of these things are really addressed with this pulsed electromagnetic field. It improves energy, circulation, blood and tissue oxygenation, sleep quality, blood pressure, cholesterol levels, the uptake of nutrients, the cellular detox and the ability to regenerate cells, balance the immune system, stimulate RNA, DNA, and accelerate the repair of bone and soft tissue. Now, animal studies were done more than 25, 30 years ago through the Bassett group, I don't know if you remember that, for bones that were not consolidating in animals. And what they did, they started using pulsed electromagnetic fields way back then to be able to get bone to consolidate in animals. Then they did the soft.
This is Robert Becker's work we're talking about, yeah?
Yeah, Becker
amazing stuff. Yeah, so I mean, the general picture is that by improving flows, you get more energy, you get more nutrients brought along for healing, and you get more of the toxins and waste stuff taken out. So it's all logical, isn't it? I mean, it can't be any more logical. It just has to work.
We certainly got the benefits in the wound healing studies, so that was quite exciting.
Now, the other thing then, just at the bottom of that list, it says, you can choose specific frequencies to do specific jobs, right?
That's right.
So healing inflammation, if it's current, if it's acute, will be a slightly different process to doing chronic pain, say.
Exactly right. Yeah, exactly right. We would use above 100, below 100, so on and so forth.
Okay, so that's going around again. Anyway, so this is one of those. Oh, it's an Avasia produced device. So what's it called? A Via Chi or Via Chi?
Via Chi. It's pretty well a plug and play. You just plug it into your Avasia device, choose the frequencies you want to generate, and point and play.
Just wave it at the patient.
Okay. Just like the
magic wand.
Yeah. So so what's this on the right then? Don't think I
So
saw it.
testimonials were as soon as we started introducing this, we started getting testimonials back almost immediately. And one lady says, "I'm loving my cheap pulse. I feel like a wizard with a magic wand. Breathing and tooth is gone. Pain is gone. With a doctor, the pain is gone. It's great,
Yeah.
great." Yeah.
Well, especially with animals. I mean, we're going to show some pictures of animals being contacted directly with the electrodes, but presumably that's not even necessary. Just wave one of these things at the puppy or whatever.
Yeah, and I'll show you. We also have the soft pads that you can put under a dog's bed and beam right through the animal as he's lying down. So you don't have to be running after Fido with your wand.
Right. Amazing. Yeah, amazing. And yeah, as you said, that's important to note. The Via Chi connects with this device from the Vatsia family.
That's right.
All right, so neuroplasticity, that's a posh word for the folks. It means the brain changing its shape and size and functions and connections. It's not a done deal. It's not fixed. When you and I went to med school, John, it was, you had so many brain cells, they died one by one, and when you lost them, that was it. There came a time when you couldn't think anymore. But we found out that's complete baloney. The usual science, just made up, off the wall science. And in fact, it's just not true. Brain cells can divide, they can replace themselves, stem cells can build you new brains or new parts of brains. It's all totally different now. But what do you mean by this idea, the brain addicted to pain?
Well, I think in normal medical training does not include knowledge of pain and how to manage pain. Well, managing pain was not a big deal. You just put them on opiates and write a prescription, and if that doesn't work, you send them to see a psychiatrist to teach them to live with their pain. It's never something that you learn in medical school.
Yeah,
and what we're starting to find out now that the brain is the one that gives the pain signals. This is why a TENS device, we say that it closes the gate, scrambles the signal between the brain and the area of pain so that you don't feel the pain. But as soon as you take the device off, then the pain comes back with a vengeance.
Right.
So the brain is actually, if you don't deal with, when you first have an accident, or car accident, bike accident, whatever kind of accident, you notice that the pain only comes on when you try to move the limb. Otherwise, there's no pain, not really.
Yeah.
But after a while, what happens is your brain starts participating and gets every little department of the brain starts to participate in that feeling of pain so that it becomes a whole body sensation.
Right. So you're saying it's not just pain nerves, but the brain has to assemble the signals to give the sensation of pain, yeah?
Yes, and we start to understand now that if you cut inflammation away, and the strange thing was done actually. I think it was a fellow by the name of Casey who injected a small amount of an anti-inflammatory into, I think it was a rat's brain, that wouldn't leak out of that area. It wasn't supposed to leak out. It would be very local. And the next thing we knew, all of the inflammation throughout all of the rat's body had disappeared.
But without the chemical being circulated everywhere.
That's right. So the brain was responsible for generating the inflammation.
Right. Okay, what's this book about?
And now I love chapter 7 of Norman Deutsch's book, The Brain's Way of Healing. He's the one that has brought new attention to the brain. Up to now, the Association of Neurologists, or whatever they call themselves, said it's 3 pounds of the strangest stuff in the universe. We don't know how it works at all. We've almost given up on it, but we're learning new things all the time. And Norman Deutsch says, hey guys, there are things that we can actually correct that goes wrong with the brain that you're not doing right now. And in chapter 7, I say chapter 7 because he talks about how microcurrent can actually get rid of a lot of the things, the symptoms that people are going through from TBIs, traumatic brain injuries, and concussions, and feelings of dizziness and not feeling right. that we can actually correct by stimulating certain parts of the brain with this technology.
Right. Okay. Moving on. Oh, we've kind of made this point, haven't we? It's old school now to consider the brain is fixed and hardwired, and what you were born with is what you have to live with. It just changes according to what you need. If you need more of something, we'll give you some more.
That's right.
Let's talk a little bit about cranial nerves. We've put this picture on, but I don't want this to get complicated, folks. It is kind of medical students' anatomy kind of stuff, so don't panic. I mean, for example, look at the top there. I don't think you can see my cursor. Number 1 is olfactory. That means the nose and smell. Number 2 is the eye and so on. But the one there's 2 we're interested in, aren't there, John? The glossopharyngeal, which is number 9. Glossopharyngeal. Don't doctors love these goddamn Greek words? Glossus is tongue, and pharynx is the mouth and the mouth cavity. So glossopharyngeal is just a posh way of saying mouth and tongue. But the one we're really interested in is this one down here, number 10, the vagus nerve, and it pretty well goes everywhere, and it affects everything. It brings the calming parasympathetic signals, doesn't it? I think we should just stop at that. Just understand there's a lot more to it, but we don't really need to know any more than just those couple of things, yeah? Right.
Not unless we become very academic about it. There is a part of the brain.
Yeah, no, listen, there's a lot of folks don't want all that crap. They just want to know what can be done. Yeah. They're sitting there with migraines, or they've got bad back.
Oh my God,
it's going to help me. So keep it.
Pons, oh my God.
Now, we're going to talk about an area of the brain called the pons. People aren't generally taught Latin these days, so I'll have to tell you the word pons means bridge. Bridge between 2 parts of the brain. But anyway, you can see from the representation or the graphic, it's right down there in the middle of the brain, right in the heart of the brain, at the bottom of the skull. What does it do, John?
Well, actually, it's actually like walking into a chamber and seeing the 12 cranial nerves right in there. So we always wonder, how can we get in and stimulate the eye muscles or stimulate, get your balance back and your eyes? How can we get at these cranial nerves? Because normally I'd have to drill a hole in your head, take your head apart and go in there and print. They didn't want to do that. Mm-hmm. So we were looking for a pathway to the pons to see, and this is where this chapter 7 in Deutsch's book became extremely interesting for me, because he described a small laboratory in Wisconsin that were doing this research, and people were going to this laboratory and they were getting better after 2 and 3 single treatments. People were going dizzy, hanging onto the walls, and the next thing you know, the dizziness would disappear and they got their lives back. Especially those.
Come to that in a minute. Let me summarize this slide then. The pons is an area where all those cranial nerves end up. It's the kind of switchboard or the dashboard. And so if we can somehow access the pons, we can produce all kinds of change magic. Yeah?
Yes.
Now, how do we get at the pons? Well, you're going to explain it now.
Well, it turns out that the tongue is a super highway to the pons. If we stimulate the tongue, then we can actually get to the pons, which is only 2 inches behind your tongue. Yeah. So, and these nerves actually connect to it. So people are getting all kinds of strange.
Be clear about this. We're not going to stick a taser on somebody's tongue and press the trigger. We're talking about a tiny imperceptible current flow, yeah?
Yeah, we use this little...
Yeah, but I mean, it doesn't kind of go, it's not going to hurt them. They barely feel it, yeah. Well, I mean, there's a representation, look at what John's talking about. From the tongue, the nerves feed backwards and ultimately will end up at the pons, as he was saying. So by doing things to the tongue, you can do things to the pons. Is it on the next slide now, John, or are you just going to have to say that verbally? Oh, yes.
This is where, James.
That's taken from Twitter, isn't it? It's a little bit pixelated. I think we can read it, though. Tell us what this is. What
she said, because a lot of people that I train, usually, we may mention something like this about the research that's being done. I spend a lot of time educating people in anatomy and physiology. And I mentioned the book, Deutsch's book, chapter 7, and what they were doing. They were actually stimulating the tongue with this what they call it the pawns, where it was a bridge. Of course, they put it on your tongue and they turned it up to 200 hertz and modulated 3 seconds on, 1 second
That sounds
off.
scary, John. So you only mean they increased the frequency? They didn't turn up the zap?
Not the power. Not the power.
Not the power, just higher frequencies. Because we know high frequencies are good for inflammation, yeah?
So she decided to try it because she had it for 2 months, and she came to one of my courses and says, no answers from the medical field to know what it could be. And she had all kinds of lightheadedness and dizziness. And she gave it a try, and zap, it's gone. Also,
that's great.
Yeah, I had no success until now with the pawns. Very impressed. Love my Vasia.
Yeah. Wash, rinse, and repeat. All right, so we said we can get at the vagus nerve. Now, we don't actually need the tongue exactly, do it? It's slightly different. But
not at all.
Why would we be interested in the vagus nerve, John?
Well, the vagus nerve, turns out that there's a lot more information. 80% of the vagus nerve fibers send instructions from the stomach, the digestive system. We've often heard the stomach digestive system as the body's second brain. So what the information that gets up to the brain is through the vagus nerve, and the vagus nerve goes up and down. 20% goes down, 80% comes up, and tells the body, okay, we're satiated, or we're hungry, or we're full, or we're energy metabolism, or what it is that we should be doing or eating, or and even when the digestive tract gets sick. And you wrote a wonderful book on that called Fire
in the Belly, yeah.
Belly, yeah, where we describe a lot of problems going on in the digestive system. Now, it just happens that the vagus nerve is wrapped around that digestive tract. We call it vague because it has a vague, meandering way of stimulating everything around the digestive system, around the heart, and so on and so forth. So the vagus nerve, it turns out, like I mentioned earlier on, they found out that the vagus nerve is actually what puts you into that parasympathetic or relaxed state of eat, sleep, digest, and repair, where fight or flight is the opposite. And our brain, when it's creating inflammation, is in that
right,
fight.
It's not just going to sleep and relaxing, though, is it, John? It actually calms inflammation. That nerve, if you can persuade that nerve to fire off, it will sort of quench the fire. And can we do that? The answer is yes, we can.
This is what they found shut down inflammation was stimulation of the vagus nerve.
Yeah. So they're doing it like this picture on the right. They like everything wired and plumbed, and you need a screwdriver to make it work, generate a pulse and so on. And it's going to cost like $10,000 for one of these units. You know, you just see it.
35,000.
Oh, already they're already on the market, are they? Well, this is where the nerve actually runs. You can see is that your finger, Laurie?
No, it's actually Dr. Tracy's finger.
Yeah, okay. Anyway, there's the vagus nerve running down the back of the main artery called the carotid artery. And it's so near the surface, you think if you could just whack one of the electrodes on the skin at that spot and turn it on, it'll affect the vagus. Well, that's actually what happens, isn't it, John? So tell us how we do that.
So what we found is that when we heard the study, and the study was done on rheumatoid arthritis, they'd taken so many people, I think it was Yugoslavia, or so far away from the USA as possible. And they did a study on these people with rheumatoid arthritis. And within 40 days, they were all off their meds. They were on methotrexate and Plaquenil and all these terrible medications. And they were completely pain-free and functioning again. So I said, my goodness, if we could do this, like you said, why not just stimulate it from the outside? We can really get it right on there. If, a little bit of training, we know where it is. And if we stimulated it with a certain frequency, we can get the same effect without having the screwdriver treatment.
Yeah, I mean, the thing to say for the folks at home is that one of the major pharmaceuticals, I mean, GlaxoSmithKline have put like $50 million into investing in this technology and working out, well, of course, they're looking for a patentable product which they can sell at, did you say $35,000? We can do this for nothing in 10 minutes, so watch out you don't get run over anytime soon. Be careful. You might come to a bad end, John. Just very quickly talk us through Kevin Tracy.
This is the
Who is he? What's he telling us?
he's saying that everybody wants to use devices to replace drugs, and because we know that at the National Institutes of Health, the Defense Advanced Research Projects Agency in the States, all of these people know that we won't be able to afford drugs in 5 to 10 years. So they immediately, and the drug companies don't want to back down. They don't want to bring the prices down. They don't want to bring their shares down. So what the NIH is doing is they're doing a study on stimulating the peripheral nervous system to affect a cure. So Kevin Tracy, president of the Feinstein Institute for Medical Research, New York's Long Island, he said every cell in the body is within shouting distance of sensory neurons, so in principle, bioelectronics have a great potential. We call it microcurrent. Now everybody in the medical field is calling it a dog by another name.
Bioelectronics, it's all a big buzzword, isn't it? And you know, the irony is 100 years ago, you were called a quack if you wanted to use electricity to heal anything. Everybody knows you're a resounding quack. There's no possible way that electrical anything can change the body or heal anything. It's all hocus pocus, humbug and fraud. I just wish some of I should go and dig some of these guys up and shout at them and say, you idiot. Okay, so bioelectronics, yeah. I think we've done that, so let's move on. We do have a few things to... So how are we stimulating the spleen? That's interesting, because the spleen is one of the major organ in the immune system, right? So I can see why that would help. Explain this one for us.
Well, what they're finding is that the vagus nerve, before stimulation, what happens is the brain also sends signals to the spleen to produce tumor necrosing factors, which are part of the immune.
Keep it simple. Just say inflammatory chemicals or cytokines.
Yeah, inflammatory chemicals. Yeah. TNF. We'll just call them TNF. And when you hear about all these medications like the methotrexate and the other stuff that they're promoting on television, and they're saying that it actually brings your immune system, relaxes it because of the autoimmune disease. The body is fighting inflammation that is being created by your brain. And the brain is sending signals to the spleen to produce these tumor necrosing factors, or TNF.
There you go again. Just keep saying inflammatory chemicals, please.
Inflammatory chemicals.
Yeah. You can call them cytokines, but tumor necrosing factors, I think. That's going a bit far for the average person. And what about, so calming the heart. Well, we'd better say, hadn't we, that the vagus goes everywhere. So all the major organs, it used to be called the splanchnic nerve once upon a time. So it'll calm the heart, soothe the liver, calm the intestines, spleen, kidneys, lungs, everything all gets calmed and soothed by this parasympathetic effect of the vagus nerve, yeah? So good for people who are stressed and high blood pressure. It could stop you dropping dead of a heart attack. Just that one thing of putting the little electrodes on the side of your neck, like we just saw. Okay, so we'll come to what CRPS is in a minute. But you've got a book. This has been around some time, and I know some of my subscribers know about this book. It's really about what we're talking about, isn't it? It's full of charts for different conditions. Apply microcurrent therapy here, some of it here, you put it on the back, or you put it on the left leg above the knee and the right leg below, whatever. It tells people just what to do. I mean, it's very comprehensive, isn't it? How you treat, like what? I mean, nephritis, migraines, arthritis.
From A to Z.
Pretty well A to Z, yeah. So, I mean, it's great, for anyone who's a practitioner, this is a great starting place, is to have a book like this, and the patient comes in and says, I've got this horrible pain in my lumbar spine, so you turn it up on the page and say, right, we're going to do this, yeah? Tell us about fibromyalgia and CRPS. These are very major conditions.
Yeah, you know a bit about that.
yeah, Laurie, go on. Step in. Your voice is sweet.
No, he meant I know a bit about the protocols in the book because I drew them all, but no.
Well, all right. Well,
I felt quite uneasy sitting here, and everybody's going, yeah, John wrote the book. No, well, actually, she did an awful lot of the writing of the book.
All right. Family secrets are out. Anyway, this is the kind of thing, isn't it? If you want to treat fibromyalgia, you do it in a certain way at certain places with certain frequencies and certain intensities and so on.
Certain areas, yeah. If you want to get a diagnosis of fibromyalgia, you have to have. You see the chart on the left screen.
This one here, yeah.
Little spots. You have to have 11 of 18 of those spots that are hurting to be able to get a diagnosis of fibromyalgia.
Yeah.
So I found that maybe the solution is in where those pain areas are, and it almost always starts with the gallbladder. Would you believe that?
I would.
The gallbladder is the initiator of fibromyalgia.
Yeah. Yeah. Okay. So there's some examples. Now, what's this? Oh, we didn't say chronic regional pain syndrome. We didn't explain what that was. Anyway, tell me about this case, John.
Yeah. This particular case came to us from New Zealand, and they were so amazed by it because everybody, all the king's horses and men in New Zealand could not fix this man's hands. And he was going through an awful lot of inflammation. And this is what CRPS is. It's usually one hand, one limb, either the hand or the ankle. And it starts a lot of times at 11, 12, 13 years old. And the pain level is atrocious. It's somewhere between 8 and 10 all the time. So that people can't sleep, they can't eat, they can't do anything but think about this constant pain that makes their life a living hell. They call it the suicide disease. It's just so terrible. And the only thing that has been able to help and not help is opiate drugs that medical people put them on. And in this case, after only several treatments with microcurrent, his hands came back completely to normal. And actually, they're working with the New Zealand social medical system to get this into their clinics to treat CRPS.
Yeah, well, of course, the pharmaceutical industry will fight them all the way, but it does work. Okay, so what can microcurrent therapy do for us? People have all kinds of conditions. Oh, here's a list. Let's just gallop down the list, John. Quick, because we still have quite a few slides.
Yeah. Well, back pain, carpal tunnel, fibromyalgia, joint pain, spastic injuries, neuropathy, pain after dental extractions, peripheral neuropathy, plantar fasciitis.
Yeah, we don't know what that is. It means under the back of your heel, painful under your heel. Yeah.
Yeah, under your foot, and it's almost like a slipper under your skin that gets wrinkles in it. Gotta get those wrinkles out.
Right.
It works very well.
Now, weren't you telling me, we had a meeting before, fibromyalgia, you're getting a very consistently very high success rate, yeah? Because that's one of the worst plagues of modern times. If you have a good solution for fibromyalgia, there'll be millions of people queuing up to come and have the treatment.
Well, we haven't had a case where we haven't had success with fibromyalgia. I've been at the North Dallas fibromyalgia meet, many of these places, and we treated so many people, and they all get
good results.
My God, yeah.
Yeah, okay, all right. As I said, we've got to gallop on a bit. Well, autoimmune disease, these are inflammatory diseases too, and we've got the answer to inflammation, so maybe we can speed that up a bit. Just for the folks, these are some of, there's about, it's getting on for 200 now, I think, but certainly 100 or so core autoimmune diseases. What it means is you're producing antibodies to your own tissues. So, if it attacks your skin, you'll get lupus and so on. Bad news, and it's all to do, isn't it, with like modern things like vaccines, heavy metal poisoning, and
bad
food overload and things that just set up inflammation, and eventually the body or the immune system gets bamboozled and it doesn't really know what it's doing, so it attacks anything. Okay, so we've mentioned inflammation a few times. I don't think we need to dwell on it much now. Do you want to just do this quickly, John? This goes back to the Roman doctor Galen. I think he first
That's right.
Pointed this out. Medical students learn calor, rubor, tumor, and dolor, which means, redness, heat, swelling, and pain. And then modernly they added another one, functio laesa, which translates to loss of movement. That just about sums it up, doesn't it? If you think of yourself having an inflamed finger, it swells, it looks red, hurts like hell, and What have I missed? Oh, and it's hot. It's hot.
Coming
If you touch it, it's warm. And loss of function. You're not gonna do this if you've got a really painful finger.
Yeah.
So, all right. So let's move on. I guess we still have a few slides to go. We can treat animals, and as you rightly pointed out, it takes away the whole of the sort of placebo equation. Animals don't think this through in the same way that we do. And you can treat them and it works just as well. And I think this is a marvelous proof. It's like homeopathy, people say, oh, it doesn't work. But, if you treat animals homeopathically, they get the result, and it can't be the placebo effect because they don't know what the hell homeopathy is anyway. Anyway, this is a horse being treated with a device on the back of the lady's hand, yeah? And she's got metal gloves.
It's actually silver embedded, silver thread. Within the glove, and she's got one little patch or pad there up above the horse's eye, so that when she moves that glove around, she's able to transmit the electrical current or the soothing current all over that horse's face or cheek or whatever he's damaged.
Right, so that completes the circuit. One electrode is the pad, and then the other electrode is her hand. Yeah?
Mm-hmm.
Yeah,
That's right.
That's very clever. Okay, oh, I don't know what happened here. It looks like we've dropped the picture off on the right, I think. Anyway, can't do much about that. But anyways, to show that animals really take to it quite well. They're happy with it. It doesn't scare them. Even with humans or animals, nothing hurts, right? Although we're using electricity, let's say this very strongly, it barely tingles. And
you just have it so it's comfortable.
Yeah, it needs to be comfortable all the way. And it does, it's not like true that, just turn it up and you'll get more gain, really zap them and they'll get a good result. That absolutely isn't true. And that's true in all of holistic healing, is a little will heal, but if you overdo it, it will shut down the beneficial process. That's true of everything, yeah?
Right.
What's this here? Let's talk
this is the dog's leg. Yeah, he actually used a particular program, and his dogs. There's his comments up on the upper left. He says, I moistened his paws and taped on pads to his feet. I've been doing anti-inflammatory treatments for 10 minutes, followed by the 7-H armor, which is one of the programs for regenerative for 10 minutes. In the past 2 days, he's gone from no ability to stand or walk to being able to walk on flat surfaces. Even did a couple of stairs today.
Awesome. Yeah, so the 783, as you're saying on the right there, the last paragraph, the 783 harmonics, that's, at or very close to the Schumann waves anyway, but that's particularly good for animals then.
That's right, yeah.
Yeah, it's a sort of animal frequency, is it?
Yeah.
Yeah, okay, well, there's a handy tip for any of you folks watching. All right, now let's talk about some gear. Where do you get these things? There are a lot around. I wrote originally in 1990s about the Russian Scanar, but I think we have to say, I think we're duty bound to say that their sort of follow through and customer service has never been that hot, has it? It's worked miracles in its day, but this is definitely the state of the art now. I mean, the Scanar had, 2 or 3 algorithms. This has got 53 algorithms. I mean, you can run chakras through a person. You can run meridians through a person. Talk us through some of these, John. What would you use for anti-inflammatory, for example?
Well, we have anti-inflammatory programs. We understand now that inflammation is the cause behind 4,000 different chronic diseases. We have programs like Vaso, which was meant to open blood vessels to increase blood flow. And on the study that we did in Kuala Lumpur, we only had 2. They would only allow 2 algorithms or 2 programs. One of them was an anti-inflammatory, and the other one was Vaso. That means to get the inflammation out, run blood through it, and you'll heal. And that's how we got 100% better in all of these cases.
Yeah, so those are very powerful, those alone. But there's dozens more, aren't there? What is solfeggio?
Solfeggio is do, re, mi, fa, sol, la, si, do. It's a gradual upping, and I think the monks used to sing these chants to get closer to God, sort of thing.
Yeah.
And
have you heard that technique that people can sing to cancers and make them burst and things? That, you can get resonance going with tumor tissue. Yeah, no, some people said they're able to do that. What's PG 2500? What does that do?
It's a pain gauge is to be able to cut pain immediately on, let's say, I don't know, a muscle that has really got you on the ground where you can't stand, and we can go in immediately with PG 2500 setting and get that pain away in a hurry, no broken anything. The ones that I love to use are the neurofeedback programs, the alpha, beta, theta, delta, gamma programs. The gamma gives you that clean windshield feeling. The alpha gives you that anti-inflammatory mode.
Yeah.
It stops your spleen from producing these, what do we call them?
Cytokines you're allowed, or inflammatory chemicals. Inflammatory chemicals. We're not doing TNF. Thank you very much.
And the delta
these are like the brainwave frequencies then, yeah? You're talking alpha, beta, theta, brainwave. So delta is 2 or 3, a couple of hertz, and theta is 3 to 5 hertz, and so on. Listen, right, a second from the bottom, let's just call attention to that, because we're going to come back to that in another webinar, I would guess. You can use it for cosmetics, you can do a facelift, you can tone up the muscles and pull the wrinkles out of the corner of a person's mouth and things. So pretty awesome instrument, yeah, really, I mean, seriously awesome. And it's the professional kit. I've enjoyed calling it a hospital in a case. You can handle just about any condition. And if you're a chiropractor or a DO or MD, this is the one you're going to need, basically. Or if you've got, serious aspirations to practice on and help anybody with this, it's 4,200, which, as a passport to a professional life, I think it's great. I mean, it'll pay for itself in the first few months, obviously. And by the way, we're going to tell you where you can get these later if you'd like to look into the technology, the devices. Now, we have another one. You designed this one, you guys, didn't you? It was kindly made by the Avatzia people, but to your specs, am I right?
That's right, yeah.
And it's the sort of home kit in a way. It's still quite sophisticated, though, isn't it? I mean, give us, we can see the dial there a little bit. Can you see that? Just tell us, roughly what you can do with each different button on that dial.
From the centimeter harmonic to the Schumann waves, all the way down to anti-inflammatory programs, and maybe even what we call the golden needle in acupuncture would be that blue stem, which is on the bottom.
Yeah,
that's a probe. So that means you can apply current to a very tiny point, like an acupuncture point.
That's right, yeah.
Is that right? Yeah. And then these pads, you can just stick them on, like we saw on the horse's head, for example. You just stick the pad on, and it will work the magic in the local area around and under the pad, yeah? And
these devices actually talk to your brain, and, it's not an Alice in Wonderland thing. It's actually factual that the technology that they have come up with actually connects with the central nervous system and tells the person that has the device when the brain has been contacted. And it also tells the practitioner when the brain has accepted treatment, which is quite extraordinary when you think about it. We're going all the way back
to like dial up the brain, tingling, hello, yes, is brain speaking? Yeah.
My back.
Ready for a fax. Well, you can go and find out more about these. I don't want to dwell too long. We're going on to questions now, folks. But if you go to my website, alternative-doctor.com, just /MCT webinar, microcurrent therapy webinar. But just the initials, you don't type in the words microcurrent therapy. MCT webinar, /MCT webinar. Okay? And then don't forget these other cutesy things. This is an amazing sort of Bluetooth magic radiation thing that will transmit all your messages without even touching the person. So you can do it through a plaster to a broken leg, or you can do it through a horse's mane, or do it through a whole layer of clothing if somebody doesn't want to disrobe. I mean, it's amazing, isn't it, now, the way technology's gone. You remember in my 1999 book, I said it first. I mean, it's certainly in Medicine Beyond, but Virtual Medicine, the original one, I talked about the fact that it was actually possible to transmit qi on an electromagnetic device. And that's been confirmed by Qigong masters. They can feel it from a qi generating machine. Amazing. 1,200
you were a visionary. You said more than that. You said actually that I can see in time where medicine will be challenged with these devices, that this is the way it's going to go.
Yeah, and it is. And,
Right.
listen, I always get there first by about 20 or 30 years. I do. It's just a boast I've got. Anyway, these little pads, so you can sit on them, or you can shove them down your pants, or whatever, or sit the dog on them, as you said. Put it on the dog's favourite rug. There's a couple of sizes there. Why are the pads so good? I mean, these are relatively new, aren't they? You've been pressing for these for a time.
Yeah, I mean, if you're looking at benign prostatic hypertrophy, or that's inflammation of your prostate.
What the hell is benign hypertrophic, whatever it was you said? Come on. I know, but they don't know. Explain it. Don't use these words.
BPH.
Inflammation of the prostate.
Inflammation.
Yes. An enlarged prostate that's not cancerous or tumorous. That's what you mean.
Right, exactly that. You could actually slip one of these things and just hold it down with your lower body and stimulate your prostate and get the inflammation out.
Yeah, or just sit watching TV. We're sitting on one of those, yeah?
That's what most people do. They actually do something else, like read a book or whatever, and they're being treated.
You get bored, yeah. Okay, all right, folks. Well, all these great devices, what I want you to do is just go there. They're all explained. The prices are repeated. If you want to buy one, you need to buy one. Remember, we invented this jokey saying together years ago, didn't we? That every home should have one, which I got from a movie. I can't even remember the name of the bimbo actress now that it was, but it was called Every Home Should Have One, and because it meant an au pair girl, it didn't mean a microcurrent therapy. But every medicine cupboard should have at least the basic model. So there you go, alternative-doctor.com and just /MCT webinar. Okay, let's start taking a look at some questions. Would you use the Q&A box? There's a lot of stuff being put through in the chats. Oh, we stopped the chats. That's good. So let's go to the actual questions. I'm not sure how, what order. Give me a second to see what order they came in. Yeah, so the top one is the first. All right, so I hope... Well, a man called Paul, I won't give his second name, because he's asking about Peyronie's disease. That's on TV now. I mean, we know what Peyronie's disease is.
Yes, it is.
The penis erect, bends to one side, and it's embarrassing and uncomfortable. I mean, it's not, it's benign. It's not going to kill anybody, but it's very awkward. So can it work for Peyronie's disease? Well, come on, tell me. We can straighten up the spine, all those scoliosis things. We can align them all nicely. Can we straighten up a bent penis?
We're talking about scar tissue and collagen and so on and so forth. And these things actually respond extremely well to microcurrent treatment. And it is comfortable, and you don't have to... You don't have to wrestle with it or grit your teeth or bite a bullet.
It's just you use a comfortable level, so you only just feel it. And there's about 3 or 4 different programs you'd use.
Yeah, okay. So, I mean, we should make that point because it's not really come up tonight, but scarring is one of the first things we treat. It's absolutely fundamental to get the electrical function that we first talked about, this collagen matrix that Dr. Oshman was talking about. That it's scar tissue blocks that, so it's very important to clear that first, and it's brilliant at clearing scar tissue, isn't it?
It is.
So in fact, we could probably go out there and say, look, if you've got Peyronie's disease, try this first. I mean, the brutal surgical goings on that they offer you, I wouldn't let them anywhere near my...
I would bend it in the opposite direction,
Yeah. Will you take any of these cases, Lorraine?
Yes.
It was a joke. I mean, I don't mean
I have.
Of course you have. You're amazing. So good news then, Paul. Yes, so we're being a bit jokey, and of course it's not nice. But the answer is yes. And then another Paul. Oh, it's gone. Wait a minute. It's jumping around. I know this gentleman, Paul Grzmowski. Slide looks perfect. Which one? Okay. That was at 6 o'clock, though. That was a good while ago. Oh, I see. It's answering up about could you see and hear us? Yeah. So, Jim, any thoughts on the NES MI health instrument? What the hell is that? MI? I don't know this instrument. Do you know?
No. Well, one of the answers that comes in, because I've been doing this, Lori and I have been doing this for almost 20 years. And the reason why we haven't, it's not because we're married. We don't own shares in this company or anything else. But what we are interested in is getting the best results for our people. And one of the things that you always ask yourself when they ask me, because we're very successful at this, they say, have you heard of this machine? Or how about that one? Or there's a multiple level marketing company that sells this one. Have you tried it? And the thing is, if the device isn't first of all, microcurrent for me is body friendly. If it's also what we call a sine wave is what is the simplest wave in nature. A bird song is a sine wave. What your body puts out is a sine. If you come up to me and you tell me, well, this wonderful device has this man-made waves, square waves and zigzags, I go, your body is going to go right into a fight or flight mode if you introduce things that the body does not recognize immediately. So why would I want to do that? The other thing is the device that you're talking about, does it actually talk to your brain? Does it get your brain to participate in the healing process? Medicine has never included the brain in the healing process up to now.
Yeah, so well, body, mind, spirit, holistic people have, of course, but medicine, you're right. So we don't know what it is, Jim, but yeah, we picked this because we think it's the best, and neither, I don't have shares with these people either. We just think they're good, and want to, you know, I've seen so many miracles with microcurrent therapy, and this is definitely state of the art. So, you know, if you want to consider one, you have to go out and research it independently. Now, Aviva is now asking, calcifying tendinitis of the right shoulder, rotator cuff syndrome, but going to be a touch of frozen shoulder there, I think, as well. Yeah. We took out frozen shoulder before, folks, because we had so many slides. Frozen shoulder is a piece of cake. It's easy.
Yeah, definitely.
Really last weekend in Sacramento,
the person will go from like this, you know, within minutes, and it's yay, look at me.
Yeah, that's right.
10 minutes, 20 minutes at the most. Yeah, it's an easy. And by the way, it heals and restores. It's not that it's back half an hour later.
No.
Aviva's got a second question, which is, what device would you recommend for this? What shall we say? Well, if you're a practitioner, then you should probably get the Pro device and learn to do it for others. You'd have a lot of customers coming in.
You have them lined up with lots of people.
If you want to do it for yourself, then the Avacia Life, which is a lot less expensive and easier to use, but would be marvelous. You would use, what, 300 hertz? Or she's had it a long time, on 25 hertz, perhaps?
Yeah, you can do it on what I do is I start on the opposite limb, and I'll do it with an Avacia Life. That will work.
Yeah. There's a tip for you, for anybody. In fact, you know, if you want to treat something, treat the other side of the body with the same thing. Christiana, can you treat skin diseases such as psoriasis?
Yes. And but I'm a big eclectic. I've also used light on psoriasis, which seems to work as well, very well.
Right, so you certainly can cut down or eliminate the inflammatory aspect of psoriasis. Maybe that's not quite the same as a cure, but it's for somebody who's suffering and scratching, and some of them have pain. I mean, it actually hurts. And often that's a food allergy, by the way. Somebody recently was telling me every time he eats wheat, he's got psoriasis hurts. I said, well, it's a wheat allergy, damn it. Don't eat wheat. People often don't join the dots, you know. All right, Jay, thanks for the message before, Jay. It did help. In the slideshow, the lady whose arm was badly damaged from a fall, what particular device would be suitable? The Sports 3? I guess, yes. That was you guys doing that treatment, wasn't it?
Well, if I had the two devices in front of me, I'd take the professional one, because I'd be able to, it would guide me to where the most information is. It would tell me how well I'm doing, and what treatment to choose, and so on and so forth, because it's got a backlit screen on it giving me all that information.
Yeah.
So as a professional, I would definitely want to choose that one. If I wanted to just for family nicks, pain, scrapes, things that go on within the family, and today it's a dangerous world that we live in, certainly the Avacia Life will. That's why we call it the Avacia Life. Yeah.
So partly it would depend whether a person's a practitioner or not. I mean, if you're just doing it for the home and you've no intention of helping others with it, then probably Avacia Life is good. If you're at all professional or would like to learn to be professional, I mean, you've taken on some folks, haven't you, who you've taught this and are now making a living or good
No,
supplementary with it. Many. Okay, so that's gosh, it keeps jumping around. I have no idea why. Anyway, Thalia is the next, and she wants to know about chronic kidney disease or weak kidney function and PEMFs. You take that one on for me?
Well, chronic kidney disease, there are so many reasons for that. It could be just a collection of fat in your blood will actually start blocking up your kidneys, so on and so forth. There are things that can be done. The device will do as good a job as acupuncture. Acupuncture is a wonderful treatment for kidneys and bladder.
But it's years to learn, isn't it? That's the trouble.
What we do is we actually teach a lot of these things, and we teach which meridians, which areas to stimulate, and which ones to attenuate, but mostly stimulation. Treating directly over the kidneys and the adrenals is one of the things that we teach as well. So kidney, yes, definitely, we've had great results treating kidneys.
All right, well, that's going to partly answer Christiana's next question. Does the book Current Medicine, not the wound healing, but Current Medicine, does that contain protocols for dealing with shoulder and neck pain from degeneration? I can answer that.
Well,
turn it over to
pain is pain. Yeah, pain is pain. I mean, every sports person out there has got some kind of joint pain. 80% of all complaints about pain are related to some form of joint degeneration, whether because they were playing sports when they were younger, high school, college, that sort of thing, even professionally. I think that everybody who's ever played sports belongs to a pain federation of some kind.
Yeah. Oh, and you were telling me, these kind of devices, like, what was the figure again? Like something like half or more than half of the NFL football teams have this kind of therapy to try and get their players back on the field as quickly as possible.
It is the fastest way to do it. And these guys are expensive. I mean, sitting on a bench costs that team a lot of money.
Yeah, that's true. All right, is there a specific frequency to treat glaucoma?
Yeah, there is. And one of the first things you want to do is you want to realign the body. And those that are in ophthalmology or, in the seeing eye trade will actually tell you that once you get the realignment, that's when you can start correcting glaucoma.
Okay. Now listen, I'm just going to go back for a point. Jay Thomas, please mute your sound. Hover on the lower left, I think it is, and mute your microphone. Every time you click or drop something or clatter, we lose the hashes momentarily. You take over. I don't know why your sound would be coming through.
Yeah, he's probably doing it.
Oh, actually, I'm just thinking I've probably got the option to do that, haven't I, actually? Yeah. Oh, I can mute you. Jay, don't bother. I've just muted you. I've only just realised what was going on. We kept getting this annoying clatter and you'd disappear.
Yeah. It's wash-up time.
Yeah, all right. So Ray, this is another Ray Shotton who just asked about glaucoma. Now, Igor has quite a long and complicated question. Can you compare microcurrent therapy and FSM, that's frequency-specific microcurrent, using paired frequencies popularized in the recent book, The Resonance Effect by Caroline Mackin? I never heard of it.
Yeah,
I don't know what paired frequencies are, but maybe you guys do.
Yes, definitely. It's exactly that. They're specific. And it's very, I would say, operator dependent. You have to
a lot of these things are, as I wrote in Medicine Beyond, a lot of these can be worked by wizards who get great results, but you put in the hands of the ordinary person and they can't do much. And that's right.
Macon is very good at it. She's a doctor who's been around for quite some time, back in the 90s. And she's extremely good at it, but somebody else may not be.
Yeah, okay. Okay, Albert wants to know, would this work for MS patients?
There are several steps in MS that might be looked at, and we were talking about stimulating the tongue. It may be one of those ways of being able to do that.
Right. Okay, Michael is asking about the Spooky 2 and Rife. Michael, I've got to say this is not a Rife machine webinar. I'm going to be doing one actually with one of the leading Rife scientists, if you like, in a couple of weeks. Look out for that. We don't want to be distracted with Rife technology just now. Michael, you're correcting a word there. Yeah, sorry. That's okay. I could guess what you're saying. Christiana wants to say the webinar was great. Thank you. Thank you, Christiana. Jay, he's saying, so it's a follow-through to an earlier question. I think my mother gets a lot of arm damage like that. And yes, I'd like to be using it professionally. Okay, we'll firm it up, Jay. What you want is definitely the Sports 3. Just go off to that. Remember that? Let me... I think the link is still up, isn't it? These are the boxes I'm looking at. Shouldn't be obscuring anything. So it's still there. alternativedoctor.com/MCT webinar. John, I don't know how to say your second name. Tony's, is it? Or Toenies? Anyway, looks a cute name. Will the pads, etc., work with the Life or just the Pro model? Good question. Both, yeah. All you're doing is feeding the machine into the pad, John. So that's an obvious yes. Does vagus nerve stimulation require a specific frequency? He's got the Cosmodix Gainer that's not really tunable, apparently. This is what Michael Hall is telling me.
It's actually, the Skinner most of them don't really go down below 14 hertz. And the frequency for the brain for what we call alpha is actually 7 to 12 hertz. So you'd have to be in that 7 to 12 range to be able to get alpha.
Well, he wasn't asking about alpha, he was asking about the vagus nerve.
Yeah, well, the vagus nerve, remember we said by stimulating the vagus nerve, we get into that quiet, repair, sleep, eat, digest.
Right, sure, but I thought that would be stimulating it at any frequency. So you'd prefer to stimulate it at theta or delta frequencies, yeah?
I'd prefer to treat it in alpha frequency 7 to 12.
Oh, alpha, okay, yeah.
That's where the brain is in its best mode.
All right, okay, well, I've got an apology for Jay. Don't worry about it, Jay. He was muted there, so I have no idea why we were getting your sound anyway. It should only be panelists, but, you know, the weird wonders of modern technology. Anne wants to know, have you used your device on paralyzed muscles? Well, I suppose that depends a lot on what you mean by paralyzed muscle. After a stroke, perhaps, or something like that.
Yeah.
We have done stroke victims,
all the time.
Yeah.
And have you got movement going where? And I know I've seen one where you got a lift in the side of the face, didn't you? I remember that now. We had it in the previous webinar. An amazing lady whose face was collapsed due to a stroke, but then regained the position of her mouth and everything. So yeah, absolutely yes, Anne. Aviva. Again, she's got an 80-year-old friend with recurring dizziness. Pons protocol, Aviva, get yourself sorted out and get onto that tongue protocol. That was a writer's reign. Any success healing, William spelled it Meniere's, but I guess that's Meniere's, the dizziness disease. The Pons protocol would be quite good, wouldn't it? But have you got anything else to offer?
The Pons thing, I think, is wonderful because it does, that dizziness that they get at Meniere's, if it's not metal fillings in their teeth and that sort of thing that are competing, then the Pons may be the solution to that.
Right. Okay. Brent has said, which of us here device works for burns? Well, I guess they all could. I mean,
very well.
Depends on the severity and so on. Oh, look, James Oshman has come on with us. He's explaining more about Carol McMackin, who we were ignorant of, shall we say. I'll just read it verbatim for James. Please note that Carol McMackin is teaching her methods with great success and has hundreds of very successful practitioners scattered around the world. Many of them are MDs. Okay, so that's very clear. Who asked the question, but you couldn't get a better person to answer it than James Oshman.
Hello, Jim.
Anne was talking about the lady with paralysis. Paralysis. She's quadriplegic, C5, 6, and 7. Sam Lal is saying, how do you get the frequency signal from the device to the body target? You just stick one on the other. The electrodes are on the device. Do you want to show them the electrodes that you just put the device on? And don't forget, we talked about the via chi, which enables you to actually transmit the signal anyway. Hold it a bit nearer. So there, you see those are electrodes, Sam Lal. You just put that on the body near the organ. Like we were saying, you don't have to be slap bang on it. Okay, so Michael Hunton. He suffered from TBI, traumatic brain injury. Can you recommend a treatment plan? He's heard of the tongue stimulation.
Buy Deutsch's book, read chapter 7, and get one of our devices.
Yeah, well, I think you need to get a device. Norman Deutsch doesn't introduce you to those, but yes, okay. And don't forget, current therapy is. Do you have the tongue protocol in that? The tongue therapy.
No, we don't.
Listen, folks, I've forgotten one of the most important things I want to say. We've completely forgotten, and you've let me down too. Now, get your wits about you, doctor. We meant to say that anyone who picks up a device tonight, there are some follow-up tutorials with the hashes. We will teach you, they're pre-recorded videos, these, but John and Laurie will confirm with me right now, live, that they will answer any questions from anybody, anytime has got one of these devices. They're very open, and honestly, we just pass on all the customer service type requests to them. They will always answer, they will always help you out, but there are also some damn good teaching videos up there, depending on which device you have. If you got the Avaxia Life, you'd want a certain set of videos, and we'll send you to those. There's no charge for these. And if you get the Sport 3, then we send you to that appropriate set of videos. I forgot to say that, and I should.
And we have quick start guides and that we send out with the devices as well.
Yeah, so you're very well looked after. Nobody's kind of just opens the box and is left struggling. What did I just do, folks?
Just went back.
I went back to the beginning, didn't I? Oh, come on, screw that. I think I probably should go back to just do the... Oh, there's James. Handsome face went by.
Yeah.
Shui. This was... oh, there we go. That's one version of it, isn't it? Oh, I see what happens. If I happen to go past the last slide, it will default to the first slide. Right, back to the question. Sorry for all that screwing around, folks. Marcel wants to know, do you use light therapy in combination with the PEMF devices?
You can do. I know there's a lot of studies that have been done by NASA and others about blue light, red light, and so on and so forth, and how these cell receptors actually react very well to certain frequencies in light. Right. One of them, like blue light, will actually kill MRSA and golden staph in a petri dish.
Right, but I'm going to interpret combination with. They don't connect with each other. You just do them both simultaneously.
You'd have to use separate.
Yeah. Okay.
Someday.
This might be the last answer and question, I should say, unless somebody else can come up with another one. Mind you, we've had a good session. Nearly 2 hours. Go, blimey. Igor is back on. Are there any frequencies or tips for releasing tight muscles or spasms?
Yeah, really, this device, there's a program called RSI that we use for that. RSI stands for repetitive strain injury, but it is extraordinary with tight muscles, muscle spasms, so on and so forth. It calms it all down.
Right.
So yes, it does. I mean, these are some of the things that we do all day long. This technology has become legend. I think since you first talked about it way back in 1999 in your book, Virtual Medicine, we just kept it going, and it's been, the results that we get are thousands and thousands and all over the world. It's not. It's yes, I've been everywhere from Australia to India to Malaysia and all through Europe and Canada and the USA, and we have distributors all over the world as well.
Okay.
And yes, we have a lot of positive results on everything.
All right, thank you. Now, I'm going to have to, since I said that might be the last go, there's been a whole shower of people jumped on with their questions, so try and go as close to yes or no as you can. Can the Life device be used to treat Dupuytren's contracture?
Yes, sir.
Okay, Tom wants to know, can the Chi wave pad be used near the skull?
Yes, it can.
Right, Marcel on again. Do you know about VoxLife, VOXX, VoxLife HTP socks and insoles? I'm guessing those are electrical socks where you can apply current to acupuncture points in the feet.
Yeah.
You can plug almost anything into these things if it'll suit you. JJ has said, can it be used to activate chakras? You bet. daily use. Which models do this? Well, the home
Pro
doesn't.
Sport 3, right?
Yeah,
Pro
you need the
Sport.
Sport 3. The Sport 3, remember, is the one with all those super duper algorithms. You know, you can do brainwave frequencies, you can do chakras, you can do meridians, all kinds of cool stuff. There are 53 algorithms, and you two had a lot to do with some of those, didn't you, really? It was improved considerably with your input.
What we have to know is that engineers are engineers. They're not necessarily specialists in the medical field. And they always invite information so that they can. An engineer will tell you, I can do anything that you ask me to do.
So
right, but you have to know what you want. Okay, all right. Well, I'm going to stop the questions, folks, at this point. So if you didn't jump on, it's too late, because we got to the bottom of the list, and I'm suspecting, therefore, that that's probably a good moment to end. I think virtually everybody's taken away something really good, and those that want to go further can either follow the link and go and read about the devices or research it. And if they want to, if any of you folks want to ask more questions, we will pass on any email. Just reply to the Scott-Mumby Wellness email address. That will go to Vivian, who will relay it to John and Laurie. And you will find they're extremely kind and patient and answer pretty well every damn question that anybody asks. And it's been wonderful. It's been great, as always. I love having you guys. I'm really looking forward to you coming by and having dinner. And I think the trip to Vancouver Island is going to have to wait till next spring now when the warm weather comes back. I don't want to be up there.
Oh, we're in Las Vegas.
Well, it's about a couple of weeks, isn't it, anyway? Yeah. So I don't think you're not staying with us, I don't think, are you? We're just having dinner together.
No.
But anyway, we look forward to seeing you. And thanks for everybody who's still on the call. Thanks for your loyal listeners. A special thanks to James. Thanks for stepping in there and helping us out with something we didn't know. And it's nice to share. So it's been a wonderful night. There will be a recording. If you've got friends who you think might, Auntie should see this, then there'll be a link and it'll be circulated with you shortly. So you can always watch it again. It's a long video though, it's a couple of hours. So you might like to pinpoint where you'd like Auntie to watch if you send her over.
Fast forward.
So I'm going to officially close down and say thanks very much for attending. It's been a great night, and I'll now have a slight panic on how the hell I'm going to shut down. Anybody, what do I do? Well, first of all, I'll stop the sharing, so you'll see me. There we go, and then get rid of that one.
Probably a red button or something.
The red button at the bottom, and end meeting for all. Okay, so good night, folks. It's been nice.
Good night.
Take care.
Thank you. Thank you,
Bye.
Keith.